Good afternoon, everybody, and if good morning applies, then good morning to you. We are thrilled and excited that you are back with us on this fifth installment of our Burnout webinar series, and we are excited that you are here. So today we are coming to you from the Association of Clinicians for the Underserved. If you are unfamiliar with ACU, we are a national nonprofit organization, and we are really workforce people. We are focused on the recruitment and retention of a transdisciplinary team solving the access issue. We do a lot of things, some of which are listed there. You can find them all on our main website, which is clinicians.org. But today we are here to talk a little bit about something that is brought to you by one of our grants that we have, and that is the STAR Center. So we are funded as a national cooperative agreement by the Bureau of Primary Health Care to bring you free, yes, free, resources on recruitment and retention. And we also have a lot of things on the NCA STAR Center's website, which is at the bottom of your screen, and that is chcworkforce.org there. So we're going to talk about burnout today, but we do have a bunch of other different tools and resources there. So if you haven't spent any time there, we encourage you to go there and check it out. I'm Suzanne Sphere. I'm the Director of Workforce Development here at ACU, and I am joined by several other people that make up the core group that works on the STAR Center. We are led by Allison Abesekra, and she is our VP of Training and Programs, along with Mariah Blake, who is our Program Manager, and she is the one that keeps all of our things moving and going, and if you have any trouble logging in or with your audio or anything like that during our webinar today, she is your person to contact, so feel free to contact her at mblake@clinicians.org during this broadcast or with anything else you might have trouble with today. So just some webinar housekeeping items before we get started. We are recording this webinar, and we do send them out afterwards so that you can have access to either forward it on to colleagues who weren't able to make it onto the webinar today, or you can just re-listen. So that's a great resource there. Feel free to ask questions as we go along. So there might be some things that you don't want to wait to the end to ask, and that is absolutely okay. You can go ahead and put them in the questions box. If it is a non-technical question, it will be saved towards the end, but feel free to put them in as the presentation is going on today, and we will absolutely get them towards the end. So with that, I think that is the rest of our webinar housekeeping. So we'll move on to the goals of our series. So we want to, with this series, we want to emphasize the importance of addressing burnout within the organization, as well as talk about how different organizations are approaching this issue, and also most importantly, and I guess maybe I should say last but not least, not really most importantly, but learn some strategies to address burnout from a variety of different lenses. So today we are absolutely thrilled to have with us Cindy Barr, and she is the operations and facilities planner there at Capital Link. And if you don't know, or if you haven't heard about Capital Link, which I think most of you do, but if you aren't familiar with them, they hold another NCA, another National Cooperative Agreement, and we are thrilled to be partnering with them and have Cindy on board with us today. Just a little bit about Cindy. She is, as I mentioned, the operations and facility planner with Capital Link. She's been on board with them since 2005, and she works nationally with health centers to translate their program objectives into sustainable operations within functional spaces. She is a registered nurse by training with prior experience in both inpatient and outpatient clinical services, healthcare administration, capital project management, and functional space programming. She holds a bachelor's from Shepherd University and a graduate certificate in healthcare administration from West Virginia University. She is also certified by the Center for Health Design and Evidence-Based Design and an active member in the Nursing Institute for Healthcare Design. We, again, like I said, we are absolutely thrilled to hear from Cindy today, to hear her perspective from both a clinical and an organizational perspective on burnout and rekindling joy and practice to create a place for joy. So without further ado, I will go and hand it over to Cindy to take it away.
Thank you so much, Suzanne, and I am equally pleased to be here. So I'm looking forward to this discussion. I want to emphasize that it is meant to be a discussion, even though we are not meeting face-to-face. You do have the opportunity to enter questions, and I am fully planning on answering all of those questions at the end as time allows. If you have questions also that you have not entered, but you want to send me an email, at the end of the presentation, there will also be an email address. So I encourage you to stay engaged, ask those questions, again, either during, after, or via email following as you talk about some of these principles with your team and with your coworkers. Okay, looking for power here.
So Cindy, if you just left click with your mouse, you should be good to go.
Working on that.
Okay.
I have left clicked, use my arrows, it's not forwarding.
You should be good to go now, Cindy.
Sorry, still not working. How about if we do this? I am just going to tell you when to advance. Did you just advance?
Nope, you did. So you should be good to go now. Great.
All right. Do you ever have
Wonderful.
these days when you just work on and on and on and you feel like you're getting nowhere and then all of a sudden something happens? It's actually a great intro to this process that we're talking about of alignment between people, process, and place. So I am now in the right place. I finally got the process, and sorry for the delay in the people part. But as we look at place for this presentation, thinking about burnout, we do need to realize that the role of place is not singularly aside. Lots of times we think about workspace or engagement spaces with patients in a vacuum, but the role of the place is really as it works with the processes of care that you have and with the staffing model that you're using. And so think of it and the relationship of the three together as we go forward and really focus on place. These factors are always really intertwined together. The work of the team is focused, collaborative, and group. So we have focused work. We have telephone documentation work to do. We have collaborative work. Maybe we are using a model of huddles and cuddles. We do co-management. Many of us have students and residents. So there are times when we really need to collaborate about patient care, even though everyone around us is trying to do focused work. And then there is group work when the team actually is focused on case reviews or working on quality assurance, doing daily process flow. The really challenging thing is that we're often doing all three of these types of work in the same day. Some of them almost what feels like simultaneously. So how do we actually address that in a space that makes sense? Well, for focused work, we need quiet spaces. We need a quiet room. Maybe we need some sound masking, maybe white noise or pink noise or brown noise or whatever type of that background noise that helps block out conversations from the next rooms. Maybe we just really need to bring back our nonverbal communication tools. Things like even hand motions between MAs and providers can be really valuable to keeping noise down and helping people to stay focused on quiet work while other activities are going on around them. But for collaborative work, I think the most important thing is actually that visual contact. To really be collaborative, it's important to be able to see nonverbals as well as verbals. And that means really flexible co-location, okay? So we don't always have to be right next to each other, but we need the ability to be next to each other. And we need adequate workspaces. Historically, when I worked in the health center, I would have to say most of my collaboration happened in the hallway or happened in a supply closet if I thought that it needed to be a little more private. It did not actually happen in a place that was designed to be collaborative. And then group work, is it actually something that we have to go to, or can we fold group work into our day-to-day functions because it is accessible? Do we have a place to meet as a group within the clinical area? And how are we using these options of on-stage versus off-stage spaces? So by on-stage, I mean that we are in the middle of where the patients are coming in and out. Off-stage is perhaps in the back or on another floor where it is quieter and out of the public view. So as we move forward, I want you to think about the fact that there are different types of work. We're not just talking about one type, but we're talking about the importance of the interplay between all three of these. I can't hear myself thinking here. This is truly a voice from the field that I hear over and over and over. The fact that we are trying to do focused work in large group spaces, and sometimes they get a little noisy. So how do we deal with that? One principle is this principle of balance. I think when I started in the 80s working in health centers, the most difficult piece for me to get used to was the fact that all of the work was done by the staff that were co-located in what we colloquially called the pit. Now, ironically, it actually was lower because it was a converted home, and so there was a sunken living room that we all met in, but calling it the pit was actually more of a definition of how we were all in this one space working together. We've worked over the years to create more private spaces, more ergonomic spaces, more appropriate spaces for smaller groups to work. And I think sometimes the balance and the pendulum have swung to the other end, where instead of all being together, then we went to all being in our own corners, in our own offices, in shared offices, and we lost that ability to work as a team. So focused work, that was an advantage, but collaborative work and group work suffered. Now we kind of are all coming back together, and we have a lot of discussion about team rooms and all working as a integrated team and being co-located in the same room. And in many cases, the balance has shifted again towards teamwork, but the focused work has suffered. I would suggest that the best way to keep this balance is to actually consciously accommodate both types of work. And the most common way that we do that in existing spaces is we take a small space adjacent to the team room. We could convert a large storage closet. I know giving up storage is a real challenge, but if you have an adjacent or even a storage room that opens off from the team room, that works ideally. Take the door off and put a door with a glass panel in it so that you can see into that space. And if you are building a new spot or doing any kind of renovations, if you have a room that opens on to the team room, it can even be dual access so that you can go into it from the hallway or from the team room. It should not be included in the workstation. So this is not like one person's office. This is a common quiet space that nurse practitioner that gave us that voice from the field could have picked up her laptop and gone in there and had a quiet space. Or if she needed to talk to a patient without any background noise, she could have taken her phone and really talk to the patient with the door closed, but still been accessible and convenient to the team. The glass door I mentioned is really, really important. It does have to have a door, but the staff need to be able to see you. Otherwise, you just get that knock, 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 knock all the time, or people think that you're somewhere else. You're in an exam room or something. And so the group work breaks down. But having that balance in place allows you to have a balance in your processes and is really, really important to teamwork. So I encourage you to seek balance in your focused workspaces and in your quiet workspaces. One word of caution, this needs to be close. So offices or quiet workspaces that are at the back of the building, on another floor, down near a break room, are rarely used during the clinic time, and so you still see that tension. So they have a different use. They may or may not be appropriate in your work area, but I'm really talking about that balance that you have all during the day during your clinic time. So try to carve out a quiet corner everybody can use and close the door when they need a quiet spot. Today I realize this is real. We really are a team. This was actually an email comment to me from a certified medical assistant when we were making the transition to patient care centered medical home and really looking at how we were going to work as a team to manage the patient process. And I thought it was really significant because this medical assistant could have felt like just more and more and more was being laid on her shoulders, as opposed to seeing that her scope was expanding, which meant that she could participate in a fuller way clinically, but also that people would be picking up that 20% of the workday, which is kind of shared between roles. I think in order for us to give each other support in spaces, they need to be spaces that are designed with communication in mind. We need to have a line of sight. I do not have the opportunity to help you if I have no idea what you're doing. If I cannot see that you are coming out of an exam room and you may need help, I can't respond. Likewise, if I am working at my desk and I can't see what's happening in the hall, I can't respond. Line of sight is really important. So if you have an established place, perhaps you need to cut some glass panels in some of your walls just to maintain that line of sight while still having privacy. If you're creating a new space, actually take on your layouts when you get your schematics, take a ruler and draw some lines and make sure that when you're sitting at certain workspaces, you will be able to see key locations where they may need your assistance. Accessible technology, and I don't even mean just from a physical standpoint of accessible, but also where I know how to use it. Things like telephones, printers, those are the two hot spots when I talk to teams about their function. The printers may not be in an accessible space, and so I can't help you because I don't have access to the printer anyway, or phones are not accessible, or the computer is in the way, or I don't have access to a computer when I'm in that alcove. So really look at your technology, see how accessible it is from the standpoint of others being able to slip in and help and decrease the stress of the everyday process of care by being able to pick up for each other as you move through the day. And one you may not think of, but has a big impact on opportunity to give support is intuitive storage. We talk a lot about knowing where things are in the exam room, but how many of you actually know where things are in the storage closet? And that's really, really important if you're going to be able to look up and see, gee, the medical assistant's doing what I asked her to do with my last patient, and I need this, so I'm just going to step in and pull it. Well, if I have no idea where things are, then I have lost that opportunity to give support to that MA, and vice versa. If I am trying to do a procedure or I am trying to calm a patient's family and I have no place to do that, then I cannot help you. I need appropriate places in order to have the opportunity to practice the principle of support within the team. Let's listen to another voice. I can't stand working in here. They have no idea what I do. Not an unusual thing for an IBH provider to say as they are kind of trying to enter into a team. When this provider said this to me, I looked around the office that she'd been given to engage with patients, and I had to kind of agree with her that whoever set it up was more familiar probably with going to the principal's office in elementary school than actually going and conversing with an IBH provider in an integrated environment. But interestingly, what she said next was more telling about place, and that is, are we really allowed to move things? And I would encourage you to always be able to say yes within reason. There needs to be a balance between uniformity and individuality in the clinic spaces in order to practice the principle of respect. Not just respect for an individual, but even more importantly, respect for the role that that person plays in the clinical team and the type of work that that patient needs to be able to do with their patients effectively. Here is an example on the left. This is 2 rooms, 10 by 10, kind of an ordinary office space, but they are outfitted with modular furniture, and the people who are using them are allowed to change them. So one is maybe more effective for maybe a nutritionist who has a lot of models that she wants to lay out and talk to the patient about. Or maybe an MAT provider, maybe a little bit more authoritarian. The one lower, maybe a social worker, maybe a care coordinator, maybe an educator. It doesn't really matter that we can define which is which. It's more important that the staff person can say, this is how I prefer to interact with my patient. Can we switch the furniture around in here to do that? One thing that really helps that is if you are cabling your technology, you need to drop cables in multiple walls. A lot of times we're limited because we simply only have one place to hook up the computer, or else we're using a whole lot of duct tape, and we all know how well that works. So drop the lines, get some modular furniture, and then say, put this in here however it works for you so that you can really work effectively with your patients. 2 principles, of course, that I would encourage if staff are not used to doing their own room arrangement. One is the staff person has to keep control of the door. They don't have to block the door, but they do need to be able to exit without going past the patient. And the other is maintaining line of sight. Make it comfortable so that if you're sitting, you're looking at each other eye to eye, and one is not put in a dominant position or a subjective position. And by the way, that's why consultation and teaching in the exam room doesn't work really well unless you have enough chairs for the patient to get off the exam table. Thank you so much. How many of you have ever had a call center team member actually stop you in the hall and say, thank you so much? In fact, usually they're trying to avoid you because they're trying to decrease the stress in their life. How can we affect that kind of joy in our call center staff? And one is recognizing the power of light. Using light as a point to show in the place the principle of equity, that it is not who you are on a hierarchy, but it is what you need to do and how we need you to interact with our patients. It's the function that defines certain characteristics of workspaces, not how much I make on my paycheck. And that is, we would all say, well, yeah, I suppose so. But in practice, we don't actually do that. We have this principle of kind of the corner office is the supervisor. Why is the corner office in our culture the supervisor? Because the corner office has 2 windows. Light is extremely powerful. In this example that I gave, we actually had a call center where there were 4 or 5 people kind of lined up around the perimeter of the room, no windows, kind of dark, trying to do their thing, trying to stay calm, trying to not communicate stress to the patient on the phone. That would have been okay if that was the only option. In fact, there's a lot of things you could do to make a windowless, tight room very appealing. But the stressor was that directly across the hall, the medical director had an office with a great big window, and he was only in there at the end of the day each day for about a half an hour. So whenever they got up, they saw this empty room across the hall. And it's the equity issue became the fact that the room was empty, and it would have improved their ability to communicate with patients. So walk around your clinic sites, walk around your health centers, and see if the strengths of certain rooms and the strengths of certain areas or zones within the building are supporting the work that you're trying to do with patients and the work that you're trying to do with the team. And that it's not been divvied up based on who's been there the longest or who has the largest paycheck. Oh, they are all kind of like that. This was a lead medical assistant when I stood and reached out and touched a piece of furniture. I couldn't work in this mess. That was the CEO giving me my initial tour when I was doing a site visit. Now, I appreciate their honesty, but we should be able to do something about that in order to rekindle joy in the spaces that we have to work. Obviously, neither of these people really had a lot of joy and a lot of pride in the space that they had. What could we have done about it? Not a total renovation. There's just a few things. So in the center, this red example I have is really to represent all of those scuffed walls that you have and all of that ripped vinyl. There is a lot of ripped vinyl in federally qualified health centers, and it's not intended to be that way. And it was not, it's just low on the totem pole. Now, I could wear my infection control nurse hat and say, we have a big infection risk issue here and we need to fix this. And that would be valid. But I would also like you to look at the impacts from a stress standpoint and from how you feel about the joy of your space by looking at things like countertops where the edging has been broken off, rips, scuff marks all on the wall. It takes the joy out of the space that you're working in. Likewise, chaos is not serenity. And so can we turn spaces that are unorganized, maybe where we have piles of boxes, can we simply just buy some shelving? Can we buy lockers for staff? And then don't put those lockers in the basement, put them near the workspace so that I truly can still feel I have access to my personal items, but they're not right there all in the middle of the team room. As in one team room that I saw where workspaces were lining the walls and there was a conference table in the middle of the room that was meant for collaboration and group work, but instead it had a whole pile of jackets and coats and all on it all the time. And so how can we create a place that is more serene so that it gives the opportunity for joy because stress is decreased? And what about a place for respite? Respite does not kill productivity. I don't know if you've ever heard that or if you even feel that way, but I will tell you that it is true. Working with your staff, working with clinicians, they really need respite. Now, they don't need to tune out for 2 hours in the middle of the day. If that's true, that's a different issue that you need to take care of. But through the day, we do need that restorative escape. It's just a place where you can clear your head. Maybe it's at lunchtime. Maybe it's 2 minutes after you finish working with a really difficult patient. Where would you do that in your space? And are you giving each other the freedom to do that in your space? Or are you afraid you're going to get a dirty look because you stepped away for a moment? It is important to be able to step away. It's important to be able to allow each other to do that and to make the ability to do that convenient so that stressors do not keep rising. I would much rather someone could step away for 5 minutes or maybe could go to a beverage bar that's in the work zone and get a cup of coffee or get something to drink, take a breather before they went into the team room and exploded. So don't look at these spaces as just like extras or perks, but as an integral part of the teamwork during the day, and really, really important if you're going to be able to create a place for joy. There has to be respite, brief restorative escapes, some reality checks where you can talk with other staff with, can you believe this? Is this right? Gives them an opportunity for the other staff person to say, well, yeah, that happens all the time. No big deal. This is how I deal with it. And then the personal connection, which may be more at lunchtime, but is it a place that is conducive to conversation? I see a lot of staff break areas, lunch break areas even, that are not really conducive to conversation because there's a lot of long kind of banquet tables. And so it's really hard for two people to have a conversation together in that space. Think instead about changing out those banquet tables with a few small round tables with 2 or 3 chairs around them, maybe even a counter around the wall with stools like you might see in a coffee shop, so that someone who wants quiet space or a conversation with just one person has the ability to do that. Those who want a group will always pull the tables together and they'll have a group discussion. It's more difficult and more important for you to enable people to have private conversations than for you to accommodate group accommodations. The groups will happen kind of intuitively. Privacy, not so much. It isn't that I think I'm better than they are, I just need a break. A family nurse practitioner told me this after they had incorporated team-based care for some time. And I was back at the health center to kind of see how it was going and were there tweaks that we needed to do in that alignment between people, place, and process. And I appreciated her honesty that where a large break area had been really helpful before when they were all in their own separate offices because she got to connect with other people. Now she kind of needed a break from everyone. And so the last principle I'd like to give is this principle of respite needing to complement the workspace. The more that we are in a space where we are with the team all through the day. So if you have converted, say, medical records rooms to teamwork rooms, or you've taken some walls down between offices and created one larger team space, not only do you need to accommodate quiet work, as we talked about, maybe having a step-in, quiet telephone booth kind of a place, but also when you look at the more formally organized respite areas like staff break rooms, they need to be broken up because as we're together in more team time, we need more me time. And that is the transition that I'm seeing health centers who have done team-based care for many years are now breaking their break rooms up into smaller rooms or locating them in different places just to allow people to have, again, that balance between focus time, collaborative time, group time, and me time. So as you go back and look at your place, and as we have a discussion incorporating your experiences that I'd love to hear about, your challenges that you're having, I encourage you to really look at what do I need to replace in order to create an opportunity for joy in the workplace. It may be nothing more complicated than taking that large storage room and putting some shelving in it. Or maybe you have the shelving, but it's actually taking 20 minutes and doing a round with all of the staff and letting everyone know where things are so they don't get super stressed if they need something and the person who's in charge of the storage or in charge of supplies is not available. Maybe you do need to renovate. Maybe as you think about the changes that you've made in your process of care, maybe as you think about how you have created interdisciplinary teams that are trying to work together, they don't have line of sight to each other, they don't have quick access to each other, they don't have an opportunity to collaborate through the day. And so instead of really blossoming as a team, they're getting really, really frustrated. And so they're going back to old habits, and they're kind of pulling back into their own corners. So it may be worth renovating. It may not be anything more complicated than putting some glass, as I mentioned, into walls, changing out some doors with glass panels, or taking down and opening an arch between two adjoining rooms. But do look at some really minor renovations that will allow you to create balance between focused and group work and maintain line of sight for the team through the day. Repurpose spaces. I briefly mentioned how some people have taken old medical records rooms and turned them into team spaces. If you have other spaces that you want to repurpose, like that large staff break area, and you want smaller ones, consider flipping them with some of your smaller conference rooms. For example, you may have 2 or 3 small meeting rooms within the building, and you have a large staff break room. Do you maybe need to take a couple of those small meeting rooms and make them into distributed break areas and take that big break area because now you need a large conference room for group work? It's not really renovation, but it's definitely repurposing so that you can reach that goal of utilizing all of your space effectively throughout the week. And simply reorganize. Be willing to just pull everything out of a room and say, how are we going to rework this room? One example that I can give you is, are you working your backs to each other? How can you turn your workspace so instead of facing the wall, I'm now perpendicular to the wall? So you and I can have a conversation without having to turn our chairs around. I know what you're doing. I know if you're available or on the phone. If I holler out, Mary, can you help me? And you're on the phone and we have our backs to each other, that's a stressor. But if our chairs are perpendicular and we're working so we have line of sight, and I know you're not on the phone, and I know you're not trying to finish something up, and I say, Mary, can you help me? That's team care. And that brings joy because we're sharing the workload. So all of a sudden, just because of reorganizing the space, you've turned a common stressor into an opportunity for joy. I would encourage you to look at that. There is a lot that you can do in your existing space. And then I hope as teams and as individuals, you learn to rejoice in the space that you have been given to work together. Now I'd love to hear your questions. Do we have any questions that have been submitted?
Hey, Cindy, it's Suzanne. I don't see any questions that have come in just yet. Feel free to go ahead and put them in the questions box. And Cindy, we have plenty of time to answer questions, so I know that she would love to hear them. This is definitely a great perspective. I know so often we hear about, when we talk about burnout and resiliency on a lot of levels, we think about what we can do from a personal level, but this is really wonderful and interesting and really, I think, thought-provoking for a lot of folks. They're probably in the line thinking, my goodness, I haven't really thought about designing a space before. So we'd love to hear some questions. And I'm sure Cindy has a wealth of experience and a wealth of knowledge, as you've heard. So I'm sure anything she would love to tackle around this subject.
You're giving me a real challenge. So please feel free. I'm happy to take it. And I'll tell you, there is no blanket answer to any of this. It's really how can we align our place with the processes and the teams that we have. So also don't be discouraged if the place that you have to work is not as optimal for where you've worked before. If it's not in alignment with what you're doing, you may also want to look at tweaking your processes a little bit. You know, if you can change the place, but if you are limited in how you change the place, look at the place from the standpoint of what would work here best. So I'll give you a concrete example while we're waiting to see if there are any more questions. This is in the process of care as far as the patient visit process. I get asked an awful lot when we're working, particularly on renovations, on my thought between what's called triage areas, which are really kind of weights and measures in medical primary care. Where do we put the scale? Do we put it in an alcove? Do we put it in a little room? Or do we put it in the exam room? And there are strengths and weaknesses to all of those. But it is very stressful, and it can easily take the joy out of the first half hour of any clinic session if it is not in a place that's conducive to privacy and if it doesn't have enough space, and if you don't have the people to actually man it. So if you have one person that's trying to do it, by all means, put them in one place and let them run it through and be really, really efficient. If you have MAs that are matched to providers and they're doing patients to providers and they're taking them directly to the room, then those patients are going to start talking to those MAs. Your objective is to build relationship, and you don't really want them to talk to you in the hall. So don't stop them in the hall. Lots of times I hear people say, well, we'll talk about that when we get in the room. If you hear that kind of thing, think, okay, the patient was triggered to talk. We have been working on building relationship with our patients in order to have long-term outcomes. Should I have been doing what I was doing when the patient wanted to talk to me? Should I have taken her directly to the room? Or should we have a more private place? So continuously be thinking, and you might even want someone on your team to take this on almost as an informed observer one morning to actually look at how you might either reorganize your space or change your process so that the two are in alignment.
Great. Thank you for that further clarification. And it doesn't look like we have any other questions on the line, but I know that Cindy's email is there. So if you have something that you take this back to your leadership or your team and you think about it and you come up with a question, I'm sure she'd be happy to answer it. Or you could send it to us at info@clinicians.org. And we would be more than happy to answer it or get it to Cindy if it's out of our purview. Cindy, thank you so much for, again, sharing that wonderful and really important perspective on burnout and joy in practice, because without a great space, it's really, as you mentioned, it's really hard to feel fulfilled in your work. So thank you so much for that. We really, truly appreciate your partnership and your willingness to be on with us today.
Absolutely. Thank you for the opportunity.
Yeah, absolutely. So with that, we've got of course, as I close my questions box, one comes in. So the question says, from an administrative lens, how do you engage administrators to lead and support a burnout prevention organizational framework and approach to make this an easier reach for providers?
So can you, I didn't catch the very beginning of the question. Could you repeat it again?
It just says, sure, I'd be happy to. From an administrative lens, how do you engage administrators to lead and support a burnout prevention organizational framework and approach to make this an easier reach for providers?
Oh, absolutely. Thank you for repeating. So from an administrative lens, two things come to mind immediately. One is the first principle of organizational stability is actually sustainability. And so we can't develop a relationship with our patients to actually move outcomes if they don't know if we're going to be there next year. And we can't build effective relationships with our patients if we don't have some stability in our workforce. So if we have continuous movement in our workforce, whether we're talking about front desk or we're talking about providers, then patients just kind of, they don't develop relationships. They don't become as vulnerable as they need to become in order for us to work with them to improve their health. And so from a retention standpoint, I think that we really need to look at this continuous alignment of the people, place, and process. And we need to continuously look to make sure that our place is keeping step with what we're asking people to do from a place and a process standpoint. And I think from an administrative, so that was one. From an administrative lens also, I want to look at this issue that in order to do new things, I need to be able to do what I'm doing really effectively. So looking at the issues of efficiency and effective use of resources, and how can I use this piece of equipment, or how can I utilize this new position that we have funded? How can we use these resources optimally to make a difference for our patients? And really looking at these issues of burnout from the standpoint of optimally using what resources we have before we just keep dumping more resources in is really important from an administrative lens. So when I'm communicating between administrators and providers about this issue, it's usually about responsible and effective use of resources that we have been given, and then also supporting retention, not from the standpoint of retention in that we do whatever we can do to make people happy, because whenever you do that, there's someone that you have now made unhappy, and that's a cycle you get on that you never get off, because it's just your changes for one person are going to negatively impact the other just by definition. But instead looking at retention from the standpoint of how can we bring joy to the workplace so that stress reduction is not only a goal that we have for our patients, but it's a goal that we have for our staff as well. And Suzanne, if you'd like to add anything to that from your perspective, I'd love to hear your perspective on that as well.
Yeah, absolutely. I would completely agree with you. I think that, you have to make it equitable, but also that it is something that, start small but start, right? So yeah, obviously that we're, have this webinar series, but I think one of the most important things is to realize that it's not going to go away. And even if you can only do one thing or in a small way, you do need to start and be very open and try to have as open a mind as possible when it comes to the subject, because even though it seems, and it can be sort of a very broad subject, it's something that I think just starting the conversation is imperative, and recognizing that it does happen and it is important. And, even if you don't have providers or frankly other staff, I know we focus a lot on clinical providers, but really all staff who are exiting your organization and exhibiting signs of burnout, you need to make a plan now to address it from whatever perspective you're looking at it from a physical pace standpoint, from your team to, to personal resiliency, all those type of things. You need to start addressing it, because if you don't start addressing it, then things are going to start happening that, that you don't want to happen. So I would definitely just say start, no matter what aspect you're doing it from.
Yeah, really good points. And when you were talking, Susanna, it made me think also of the fact that we put resources into looking at exit interviews and why people are leaving and what's causing people to leave our space and go to a like space. And I think that is valuable. Learning why people leave is certainly part of the picture. We don't take enough time to actually look at why they stay and make sure that the vision and the goals and the strategies that we have planned for the next 3 to 5 years are not going to negatively impact the reason why people are staying. I think that that's an important filter too. So if we have a particular way that we're practicing in a particular satellite, say, and your vision is to build a larger, bigger place, how are you going to make sure that what is of value in the old place is maintained in the new place? So when we work on new capital projects and we have the opportunity to really look at that early pre-planning, one of the questions I always ask the team is, what do you hope doesn't change? Because it's why you're here. And I think that's a question that we need to ask in a preventive way from a recruitment and retention standpoint.
Absolutely, that's another great point. And we do have a second if you all would still like to ask a question but haven't had a chance yet. So we'll give you guys just a second to do that. And while we are doing that and waiting for questions, any other questions to come in, I wanted to let you guys know that next week is our last in this series, and Dr. Eileen Barrett will be back with us to talk about improving recruitment and retention by increasing professional satisfaction. So we'll hope you'll join us for that. And it doesn't look like any other questions have come in yet. But as we wrap up, I want to let you guys know, I didn't say it at the top of the hour, so I'll let you guys know now, that you can download a copy of Cindy's slides in the handout section of your go-to toolbar. If you'd like to go ahead and download those now, they will also be available on our website this afternoon or tomorrow. So it doesn't look like any other questions have come in, but thank you guys all for your participation today, and especially to Cindy Barr for being with us today. And let us know what we can do to support you guys in this work if it didn't come up today. And we will talk to you next week on the 16th for our last session. Thanks, everybody. Have a great afternoon.
Thank you.